Hey guys, I am here at Atlantic Health Systems Atlantic Sports Health with Adam Kahn, physician assistant, and really the quarterback to 111 Madison Atlantic Sports Health with Dr. Damian Martins. Adam, great to have you on today, and I know we're going to talk a little bit about mononucleosis and I guess a situation that you see a lot of recently, right? I mean, talk to us about this disease. How does it happen, and how to take care of it, how to treat it?
Sure. So infectious mononucleosis is something that patients get, and normally at the age of 15 to 24 is when they present. That's the highest prevalence, which obviously, with athletics, a lot that we have to deal with here at Atlantic Sports Health. And the key here is not just feeling sick, right, and when should you be seen, but with mono, it really takes on a different perspective just because the athlete is at risk, not only to play and be fatigued and put themselves at harm in that way,
Right.
but also for splenic rupture and ultimately death, which is what we want the athlete to know, when they're feeling a certain way, that they have to go and see a physician, not to just say, oh, I'm tired, I'm fine, and push through.
Sure, interesting. Now, talk to us about the symptoms. I know obviously feeling fatigued, but a lot of kids feel fatigued, right? They don't get enough rest. They're not getting the hours sleep that they should be getting, 8 to 10. Very few athletes are getting that. What can a parent be looking for to say, hey, maybe we should go see a doctor?
Sure. So a lot of times you'll actually be feeling some symptoms of mono 4 to 8 weeks before you present with it. So just general malaise, some fever, and some headache, all mild. But when mono really presents the initial time, you're going to have a sore throat. You're going to have lymphadenopathy, which is swollen glands specifically in the neck, and then also the fever. Those three, 85% of the time, are all present.
Wow.
And then that's with underlying fatigue and new onset of that sore throat, those lymph nodes, and then anytime those present, you have to go and see your physician to rule out whether it's just strep and can be treated simply with antibiotics versus mono, where there's other workup that is necessary.
And how do you diagnose mono? Is it
Sure. So there is a monospot test, which is very specific, meaning that it will show that you have mononucleosis. It's not perfect with ruling out, so if it's negative, it doesn't necessarily mean that you definitely don't have it.
Interesting.
There is further blood work that could be done, antibody tests, that can show if this is an acute reaction versus something you've had before in the past, and also trying to predict how long that you've had this illness.
Interesting. So initially it's blood work, blood makeup, and then further blood work to
just confirm where it's at.
Interesting, interesting. And then obviously treatment of mono, how do you go about?
Yeah, so treatment's really supportive in nature. So it's a virus, right? So really it's rest, it's proper hydration. You can use acetaminophen or ibuprofen for either pain, body aches, and for some of the soreness. That'll help. With the sore throat, it's always good, to gargle salt water. We're a huge component of fans of gargling as much salt water as you possibly can, literally 6 to 8 times throughout the day.
Yeah.
You can do a lidocaine swish just to help with the soreness of the throat and go from there. But beyond that will normally, it's just really rest and, unfortunately, the tincture of time.
Yeah, and you got to make sure you fully recover from it to go back to any type of physical activity.
Absolutely. So this is where it gets a little dangerous. So about 50 to 60% of patients that do have mono do get their spleen enlarged, which is called splenomegaly, right? And what that puts them at is risk of rupture. Now that's not just if they get hit, that's also spontaneous rupture. And that normally happens 3 to 4 weeks after the symptoms present. So if somebody presents with mono, they need to be held out for a minimum of 3 weeks before doing any activity at all. And then 4 weeks if they're doing contact or anything beyond.
So a minimum of 3 weeks when diagnosed with mono, and realistically 4 weeks from any contact, minimum.
And then understand, right? You now have an athlete that's fatigued, and those symptoms can last a month to 6 months.
Wow.
Haven't done any activity for 3 to 4 weeks. So at that point, it's very important to slowly progress them back to full activity. So somebody who has a diagnosis of mononucleosis, they can legitimately be out 4 weeks minimum, 6 weeks, 8 weeks, really, till they're back to full activity level.
Wow. Extremely informative, Adam. Thank you so much. I know our audience, our parents, our coaches, will take that information and really be able to apply it effectively. And hopefully they don't have to apply it, if their child is not affected with this mono. But if they are, they know how to handle it now.
Perfect.
Thank you so much.
Thanks, Bill.